All right, if you have type 2 diabetes and you're taking metformin, you're gonna want to stick around. This explainer is specifically for you, and we're about to break down a connection that is absolutely crucial for your health.
So you're on one of the most common, most effective medications out there for managing your blood sugar, which is great, but there's a hidden side effect that honestly flies under the radar for so many people. It's something you really need to be aware of.
So here's our game plan. We're going to cover what vitamin B12 is and why it's such a big deal. Then, we'll get into how metformin affects it. We'll also talk about why the symptoms can be so misleading, and this is a big one. And most importantly, we'll give you a simple playbook to protect your health. Then we'll wrap it all up with a one key takeaway you won't want to forget.
Okay, first things first. Let's start with the basics and meet the star of our show today, this unsung hero of your body's daily operations, vitamin B12. Vitamin B12, sometimes called cobalamin, is what we call an essential nutrient. And that word essential is key, right? It means your body just can't make this stuff on its own, so you have to get it from your diet. Think of it as a powerhouse worker, keeping your nerves, your blood, and your energy systems all running like they should. I mean, just look at how much B12 does. It's like the protective coating for your nerves, a critical ingredient for making healthy red blood cells. It's even a building block for your DNA. And it's basically the spark plug for your brain and your energy levels. It is a true master key to your overall health.
Okay, so now that we know how important B12 is, let's get to the real heart of the matter, the metformin connection. This is where we uncover that hidden risk I mentioned.
So here's the deal. The metformin you take to manage your blood sugar can actually interfere with your gut's ability to absorb that essential vitamin B12 from the food you eat. So it's not that you aren't eating enough B12, it's that your body is having trouble getting to it. And get this isn't some rare, one-in-a-million thing. Studies show that a pretty big chunk of people on metformin, somewhere between 10 and 30%, have lower levels of B12. Think about that. That could be as many as 1 out of every 3 people. It's a really common issue that just gets overlooked.
And you know, the longer you're on it, the higher the risk. If you've been taking metformin for, say, 3, 4, 5 years, or even longer, your chances of developing a deficiency go way up. It's a cumulative effect, which is why it's so important to be aware of this, especially if you're a long-term user.
Now this is where things get, well, a little tricky. How do you even spot this problem when the warning signs look almost exactly like a condition you're already dealing with every day? This is the real danger of those overlapping symptoms.
And this right here, this is the absolute core of the problem. You know about diabetic neuropathy, right? That tingling, numbness, and burning sensation. But here's the thing. The nerve damage from a B12 deficiency causes the exact same symptoms. You can see how easy it would be to just assume, oh, it's just my diabetes acting up, when it could be a totally treatable vitamin deficiency.
And beyond that nerve stuff, there are other red flags to look out for. Are you feeling just wiped out all the time? That kind of deep, crushing fatigue that won't go away? Or what about memory issues? That brain fog that makes it hard to concentrate? A sudden loss of appetite? Or even mood changes? These could all be signs that your B12 levels are running low.
Okay, we've laid out the problem, but don't worry, this isn't all doom and gloom. Not at all. Now we get to the good part, the solution. This is your prevention playbook. Clear, simple steps you can take to protect your health starting today. And honestly, it boils down to these 3 super simple steps. First, get tested. Just ask your doctor for a simple B12 blood test. Second, try to eat more of B12-rich foods. And third, if your levels are low, talk to your doctor about supplements. It can be a really easy fix, like tablets or maybe injections. So you might be wondering, when should I actually ask for a test? Well, here are some clear triggers. For sure, if you've been on metformin for over 3 years. Also, if any of those symptoms we just talked about, the numbness, the tingling, that deep fatigue, if any of that sounds familiar. And it's especially important if you're on a vegetarian or vegan diet, because B12 is mostly found in animal products. And speaking of diet, here are the best places to find B12 naturally. Things like fish, meat, eggs, and dairy are all fantastic sources. If you don't eat animal products, no problem. Just look for fortified foods like breakfast cereals or certain plant-based milks that have B12 added right in.
Phew, we've gone over a lot of ground. So let's boil it all down to the one thing, the single most important message that you need to walk away with today. This is your most important reminder. It's this simple. Just burn this equation into your memory. Diabetes plus metformin equals you need to check your vitamin B12 levels regularly, It should just be a standard part of your diabetes care plan.
And why does this matter so much? Because being proactive here isn't just about fixing a number on a lab report. It's about improving your quality of life. It can protect your nerves, bring back your energy, and really just help you feel more in control of your diabetes management as a whole.
So I'll just leave you with this to think about. If you've been struggling with some of these symptoms, if you've been feeling off, could a simple, essential vitamin be the missing piece of the puzzle to your well-being? It's definitely a conversation worth having with your doctor.